weather app. Now, you're watching Wave 3 News Listens Live.
And it is a celebration.
With your host, Jon Ramsey.
Hello and welcome into Wave 3 Listens Live. This is the Wednesday edition, and I think that everyone deserves the right to smile with confidence. A big mission of this show is to bring you technologies and products that can enhance your life, and certainly Freedom Mini Dental Implants is one of those, because if you wear dentures, if you know a loved one who wears dentures, you know about the discomfort, the glue, the hassle. Wouldn't it be great to throw those away? And wouldn't it be even better if it was affordable to actually have teeth that fit, that work just like your regular teeth? That would be great, wouldn't it? Well, it can happen at Freedom Mini Dental Implants. There we go. Dr. Regan Ackerman rejoins me once again. Dr. Ackerman, welcome back to the show.
Thank you.
Good holiday?
Yes, wonderful.
Now, I think you, in your business, you would agree with me. Everyone deserves the right to smile with confidence and feel good about their smile.
Definitely. I mean, a smile can be life-changing, and I see patients all the time that are embarrassed to smile, don't smile, they're afraid their denture is going to fall out, or maybe they're missing a front tooth or a couple teeth. And, you know, when we do this procedure with the mini dental implants and we give them their smile back, I mean, it's just amazing. You know, I was telling you before the show yesterday, we had a patient that, you know, cemented her permanent teeth in and just tears. Like, she was just like, they look just like my teeth, and so happy. And it's life-changing, and everyone does deserve that smile, for sure.
Yeah, that has to be rewarding for you.
No, it is.
When someone, I would hear, I bet that you hear this a lot, is, I wish I'd have done this sooner.
Yes.
And if you were apprehensive, and the reason being perhaps, and we all have a budget, I certainly understand that, maybe you were apprehensive because you thought, you know, I can't afford it. I went to my dentist and 20 years ago, and they told me what it was going to cost and how long the procedure would take, and there was going to be some surgery involved. Well, I have good news for you. This is totally different. And Dr. Ackerman, for those who have not seen you, tell us exactly how it is different. Maybe compare the old method with the new procedure.
Yes, yeah. We've come a long way in implant dentistry. The mini dental implants, it's kind of just the less invasive way. I don't make any incisions. I'm not placing any stitches. The healing time is a lot less. Essentially, the older method, the bigger, they're just big implants, and the mini dental implants, it's just a smaller diameter implant, still made out of titanium, still as strong, but a lot less invasive. No swelling, hardly any bleeding,
no bone grafts,
no sinus lifts. And I'm able to help a lot of people out, like you had mentioned, that were told they weren't a candidate for the surgical implants, or they were just way out of their budget, because the mini implants are a lot less invasive and a lot less costly than the surgical implants.
Yeah, so if you don't like a lot less pain, if you don't like a lot less money, then you probably won't like Freedom Mini Dental Implants. It really is. I've done my research. The news is all good, and we want to show you. We like kicking off the show with a little before and after picture to see the impact and the difference it can make. Okay, tell me about Chris.
Yeah. So Chris came to me, and bless his heart, he had an upper denture. It had broken half. He was like gluing it back together, then using denture glue, just struggling with his denture, and he knew he needed a better solution. He was tired of, you know, the denture breaking, tired of using denture glue. So we ended up doing a snap-in denture with him, which I'll show later. Got his smile back, and he's looking great and confident, and, you know, when he comes in, he just smiles and able to eat more and chew more, not self-conscious about his, you know, teeth anymore. And
look, that's a handsome individual right there.
So, and you can tell he just smiles more, you know, and more confident with the before and after. So it makes a huge difference.
Because you and I have been doing this for quite some time, I've seen many before and after pictures, and it's amazing how much more youthful someone looks and how much more genuine the smile appears. I mean,
for sure,
people are genuinely, the confidence is something that just exudes from you.
Yes.
And I think if you're not confident in your smile, and we've all had friends or loved ones who put their hands over their mouth, or they're afraid their dentures are going to slip, so they don't have a full, genuine smile. And that's sad.
Right.
But when you do, when they have it and they feel it, it's real.
And so many people, like you said, they kind of, what I say, they suffer in silence, because I bet everyone has a family member that is struggling with missing a tooth or a denture, and you may not know it because they don't want to talk about it. They're embarrassed, or they're suffering in silence. Or, you know, when they go out to eat with you, they're ordering soup for a reason because they're afraid to order that steak or things like that, you know, because they can't eat what they want to eat.
And that's a good point there, which kind of helps me kind of transition to the next point, is foods that you love so much and you have to do without, whether it be nuts or a steak, anything that's chewy, crisp, and they're full of nutrients. experience as well. So there's so many reasons to go to Freedom Many Dental Implants, and I think now is the time, and we'll repeat this, but consultations are free.
Yes, yeah. All they have to do is call the office, make a consultation appointment. It's no charge for the consultation, and there's an x-ray, usually a 3D x-ray at no charge, so that can make sure you have enough bone. Pretty much 95% of the time, you know, you have enough bone for the mini dental implant because we don't have to have as much bone, we just have to have some bone. So it's pretty rare that I tell somebody that they're not a candidate, even if you've had dentures for 20 years. You know, I've done implants on, you know, patients that have been missing their teeth for 20 years. So, but yeah, the consultation's free. Just call and make an appointment, and I'll, you know, see if you're a candidate and go over the process and see, you know, see what your options are.
571-5263, 571-5263. Call with your questions. It can be about you, a loved one. It can be one tooth, two teeth. It can be a whole set of dentures. They love throwing away dentures. That's something they do very well at Freedom Many Dental Implants. Okay, for those of you who are perhaps asking the question, you're saying, okay, how come it's less invasive? How is she able to do this without bone grafts? Okay, if you would.
Yep.
This model, I think, is very indicative of what you do.
It is. I don't know if you can kind of close up on it. So this shows you kind of the hole they make for a surgical implant. That's the big hole. That's the old way of doing things. And the mini dental implant is this
you
small,
can hardly see it.
hole. I will say I was doing a consult yesterday, and a patient was like, "There's another hole there?" He had to get his glasses out to see it. So the small hole is the hole I make with the mini dental implant. So you can see that you don't have to have a lot of bone.
So you don't need the surgery.
Some bone. Right. No surgery. When I make this little hole, I don't have to do any incisions, no stitches. It heals up faster. You know, I would much rather have this small hole than this large hole.
Just a little Novocaine.
Just a little numbing, and then, you know, make that little hole, and the mini implant's just like a little titanium screw. Screws down in, and, you know, we snap the denture in that day if we're doing the snap-in denture, which, you know, we'll show all those models.
I'm curious about, I bet people are amazed at how simple it is, because they've been told in the past that, okay, I'm going to send you to this surgeon, he's going to give you a bone graft so that you have more bone. You're going to wait for a while, and then you're going to come back here, and they're looking at all these procedures, all this pain, and it's very invasive.
Yes.
And then you tell them, okay, this is what it's going to cost, this is all you go through, and we can do this really quickly. And they're like, what? And that's what this show's good at, is telling you things you may not be aware of. Now, Freedom Many Dental Implants are not new.
They're not new.
You got it down to an art.
Yeah, I mean, they've been around for 10+ years, and like a lot of people may not know about them because, you know, if you've been missing your teeth for that long, you haven't been to the dentist. You don't know this is an option. You know, and a lot of my colleagues may not know about it and the advancements that we've made in mini dental implants. You know, because they started off as a, you know, for denture stabilization, and then the technology just got better and better and better, and now we can use them for snap-in dentures and for the permanent teeth, or if you're just missing one tooth. The mini dental implants have been around for 10+ years, so the study is, and the research is there that they work.
In the next segment, I want to show folks the models, and exactly, there's two methods they can use, and one of them is probably right for you. But I want to talk a little bit about the complaints you hear most about dentures. I'm going to go ahead and assume, I don't wear dentures, but I've been around enough denture wearers that it's the glue.
Yep.
And
how long do we have?
That's a good point. I've got a grocery list here.
The glue would be number one.
Okay.
The glue, the roof of your mouth being covered and not being able to taste your food. So with the permanent teeth, we can get rid of, you know, anything covering the roof of your mouth, and can taste your food again. But yeah, definitely using denture glue, gobs of denture glue. So getting rid of the denture glue is number one, and then being able to taste your food again. Those are probably the top two complaints for sure with denture wearers.
Wow. So if you have a question, perhaps you have a complaint, or you want to know, are you a good candidate? 571-5263. Want to remind you once again before we go to break, Freedom Many Dental Implants, the consultation is absolutely free. So if you're curious, maybe you have a question you do not want to discuss on the air, then you can see Dr. Ackerman, and she'll be glad to see you one-on-one and tell you if you're a good candidate. And by the way, most people are.
Yes.
Good candidates.
Yes.
I mean, very, very few are turned away.
It's pretty rare that I have to tell somebody they're not a candidate. Yes.
Wow. All right. So there you go. The news is all good. 571-5263. If you have a question for Dr. Regan Ackerman, we'll take a break, and then we'll take your phone calls on Wave 3 Listens. We're live.
My children are my heart. My father passed away from a heart attack at 49. He was my best friend, and losing him changed our family forever. I don't want my children to live in fear of losing one of their parents.
We're working together to build a healthier community.
Please join us for the American Heart Association's Heartball, Saturday, February 8th at the Kentucky International Convention Center. Go to wave3.com to learn more.
A message from attorney Mike Sullivan about disability benefits.
You can't work anymore, you file for disability, and they shut the door in your face. Don't let Social Security deny your future. You paid into this system. Now, it's their turn to pay you. Fight back. Let me open that door for you. Call me now. Come on in. We got this.
Call 888-587-0228. Call now.
Freedom Mini Dental Implants. Dr. Regan Ackerman joins me once again, 571-5263 if you have any specific questions. We promised we'd show you the models. There's two different methods, two different procedures, and you can take your choice. Both of them a lot less expensive than the former method. So, but if you would, please show me a little bit of what you do. Okay, what's the first one here?
So we'll do the Snapping Denture first, which is kind of probably one of the more common things we do. So what this shows, you know, so imagine this is your mouth without teeth.
No, so this isn't plastic, this is your mouth.
The plastic does not go in your mouth. This is your mouth, yes. So, and these are the mini dental implants. So like I said, they're just small diameter implants. So like you said, when I place these, just a little local anesthetic, little Novocaine, don't have to put you to sleep or anything like that. Don't need a lot of bone. And I'm not doing any incisions or stitches. So I place these implants, and then the day I place the implants, you'll kind of see these attachments inside the denture. You will leave with your denture snapped on to the implants.
Very secure.
Yeah, and then you have so much more confidence. You know your denture is not going to be, I mean, I'm tugging on this right now, so, and it snaps in. But you've got that confidence to know that your denture is going to stay in. You don't have to use denture glue anymore. You can chew better, you know, chew steak and carrots and all those things that you may not be chewing because you're afraid your denture is going to flop out.
Okay, and that's fantastic. So that secures the denture.
Yes.
Now, if you want to have your own teeth, your third set of teeth, before we get into that, I had a question, and I want to address that now before I forget.
Okay.
The dementia is setting in here with me. But the question was, she is a diabetic. Young lady called and said she was a diabetic. Says, is she a candidate?
Still a candidate, yes. I place these mini dental implants on people that are diabetic all the time. I mean, obviously, if it's controlled, that's much better. It makes the success rate much better. But that does not make you a candidate for the implants, for sure.
So you can. So that doesn't exclude you at all.
Yeah, and in general, just talking about medical histories and things like that, because this is a lot less invasive, really medical history doesn't rule you out. Like, even if you're on blood thinners or periodontal disease.
Because you're just doing a little
because it doesn't take much healing, and I'm not making a big hole. You know, it's a very small hole. It's a lot less invasive.
Okay.
So that kind of goes back to the people that were told they weren't candidates for implants before because maybe they were diabetic or things like that. They can be a candidate for the mini dental implants.
You know, and don't be embarrassed, because a lot of times it's genetics.
Yes.
It's not the fact that you don't take care of your teeth. Of course, you know, maybe you had an accident, whatever the case may be. You've seen it all.
I have seen it all.
And you put people at ease. I can tell you do.
Yeah. I mean, it's everybody, you know, I've seen it all, and people have tried. A lot of people I see, they are just going round and round, spending money, trying to save their teeth, root canals and crowns, and then those fail, and they're just tired of going through that cycle. And so this gives them a great option, you know, if they have to have all their teeth taken out, to restore them and not have to suffer with a regular denture.
Okay, next question, and I know the answer, but I'd rather the authority answer it. The question was, is there anything in the roof of the mouth to cause gagging? Because that is a big complaint. We didn't address that one, but that's a big complaint.
Right, so obviously, and we'll show the permanent teeth in a second, when we do the permanent teeth, nothing on the roof of the mouth. It is like getting your natural teeth back. With the denture, we can trim back the roof of the mouth, you know, some and kind of get it off, and we can definitely help gaggers out. I've seen it all the time. Even because once we stabilize that denture with the implants, we can, you know, trim that back and definitely help gaggers.
Because a lot of that in the old style of dentures was to help with the stability of the suction. And you can get rid of that because you have the implants.
Yes.
Okay, now this method I love, and we have people rave about this because this is literally like having your own teeth. There's really no difference.
This is awesome. This is definitely the nice nicest thing I do. So let me get it here for the camera. So this is what we call the permanent teeth. And it's the same concept as far as placing the implants.
No plastic.
These are the mini implants, yeah. We're just going to place more implants, but then we can make just a bridge of teeth here. So no denture, no plastic, and then this will cement on to those implants. And then you can see permanently. It does not come in and out. You do not take it in and out. It is strong. You can chew and eat, you know, pretty much whatever you want. But there's nothing on the roof of your mouth anymore. Talking about gaggers, no, don't have to worry about gagging.
And you say you just get an irrigator to clean, right?
You get you're going to brush it like you normally brush, and you get a water flosser, like a irrigator, just to kind of keep this edge clean here on the front and the back. But this is definitely the nicest thing. Like you said, it's like getting your third set of teeth. That patient I was referring to yesterday, we cemented on her permanent teeth and showed her in the mirror, and just tears flowed. She was just so happy. She was one of those patients that could never wear a denture because she was a gagger, just never could tolerate a denture. So she knew the permanent teeth was the only way to go for her, and it was just amazing to see.
Okay, I am picturing this scenario, and I bet you see this a lot or hear this a lot. People who go home and they put their dentures in a drawer, and then when they have to go out, they have to put them on. Wouldn't it be nice, I'm thinking if I were a denture wearer, wouldn't it be nice if you could permanently throw that denture away?
Yes.
And you make that possible.
Make that possible with the permanent teeth. Yeah, I see people every day. Yesterday I had a patient come in. He's been in dentures for 20 years, and he's only ever worn his upper denture because never could keep the lower denture in, and I see it every day. The lower denture, your tongue's trying to push it out. You have no suction whatsoever. So if you're out there and you're struggling with a lower denture, just know you are not the only one. I see it every day, and we are able to either do the snap-in denture or the permanent teeth and get rid of the denture completely and be able to give you, lower teeth to chew with again. And that's the biggest thing. Obviously, the aesthetics is great, but being able to chew again is huge.
I agree with you. There's a lot to be said. Don't get me wrong. I think we all want to look better and be confident with our smile, but being able to chew again comfortably, being able to eat the foods that you love, no more procrastination. Freedom Mini Dental Implants. The number to call if you have a question, 571-5263. Dr. Regan Ackerman is here. We'd love to hear from you. Wave 3 listens live.
Hurt in a car? Call Sam Aguiar.
If you've been injured and people around you are telling you to get a lawyer, you should listen. Family, your doctor. They don't want you to be taken advantage of, and they're giving you some good advice, so take it. I'm Sam Aguiar. I've seen what can happen to people without a lawyer, and I wouldn't wish that on anyone.
Hurt in a car? Call Sam Aguiar. 888-8888.
Men, it takes courage to talk with that someone special when there are problems in the bedroom. And it takes courage to make a confidential visit to the Louisville Men's Clinic to get that spark back in your relationship. Our doctors offer the latest solutions, and you will see results in your first visit. No matter your age or conditions, we can help. Call the Louisville Men's Clinic now at 444-4000. Get your confidence back. Have the courage to take that first step.
Freedom Mini Dental Implants. Don't pass up that can of nuts. You want to munch on those. That steak you've been wanting for such a long time. Hey, feel free when you go to Freedom Mini Dental Implants, and I'm guessing that's hence the name. It gives you the freedom to do what you want. It gives you the freedom to feel good about your smile. You can be more of yourself. Question for you.
Yes.
All right, so here's another one. What about those who say, okay, dentures aren't my issue, but I have some problems with my teeth. I'm missing a tooth or two. Maybe it was an accident. Perhaps it was genetic. Can you help them?
Yes. Definitely. I see patients all the time that are missing like their back molars, call them your big chewers, and they're either missing them or they're trying to wear a partial. And for those of you that have it, know what it is because you're miserable wearing it. It comes in and out, and it's bulky, and nobody likes wearing them. So if you're missing just, one tooth or a couple teeth, we can use the mini dental implants to replace them as well. I know we've probably gotten a lot of phone calls about cost. I will say, to replace one tooth with a surgical implant, the older method, I've seen $4,000 to $5,000 spent on one tooth. So with the mini dental implants, I mean, we're about half the cost of that. And you get your tooth a lot sooner. You don't have to heal up as much and things like that. But yeah, and I can also show this model that shows, like you said, you know, somebody had a sports injury or they, you know, lost their front tooth. We can do a single tooth with the mini dental implant. There's a lot of people out there, like I said, with a partial or a flipper. So same process, no incisions, no stitches, no bone grafts, no sinus lifts. Place the implant, you leave that day, you know, with a temporary that looks like a tooth, and then we get the nice pretty tooth made, and we're able to cement that tooth onto the implant, and then that tooth is permanently in your mouth. No more partial, no more flipper. And then kind of like we were referring to, we can do it for multiple teeth. So like I said, if you're missing these, you know, big chewers back here and you want to chew again, we can, you know, place several mini implants, and then we kind of make a bridge here of teeth, and this cements on to those implants, and it's permanently cemented on. Once again, no more partial. You have nothing coming in and out, nothing covering the roof of your mouth anymore. You can chew a lot better with it. You know, it feels like your natural teeth. I had a patient the other day. I was asking her how she liked them. She's like, it just feels like I grew new teeth back. And I thought I was like, that's a good way to say it.
That's fabulous. Yeah. And before we go to the phones here, I do think a fair comparison, an accurate comparison, is back in the day, if you needed your appendix removed, they had to, you know, it was extensive surgery. They had to cut you open and get your appendix removed. Now it's done with a little bit of a laser. So it's that's the way this technology has evolved.
Definitely. That's a great comparison. Yes.
And it's apt. Okay, and accurate. So we're going to go to the phones now, as promised, and we thank R for the call. A unique name and a unique person. Thank you for watching. Welcome in. You have a question?
Yes, I do. I'd like to know, once you get the dental implants, do you have to come back to get adjustments, and how often if so? And if you need an upper and a partial, how does that work?
Yeah, great question. I will say it kind of depends on the procedure. I'll go through kind of all of them. With the snap-in dentures, you know, really, you know, unless you have an issue, I really don't see those patients much. You know, if the denture's rubbing, sometimes you come back to me for an adjustment. But otherwise, you know, good to go. And then if you're replacing teeth, you know, one tooth or several teeth, you know, the day we cement those teeth on, we give you a water flosser, and you're going to brush and take care of them, and you're still going to go to your regular dentist and get your cleanings. And if you ever have an issue with the teeth I cemented in or the implants, then you come back and see me. But for the most part, you know, once we cement them on or give you the denture, you know, and get past maybe that first week of, you know, fine-tuning things, then I don't see them, you know.
And
so,
that's a good thing.
Yeah, it is a good thing.
I mean, don't get me wrong, you wish them well.
Right,
but believe me.
Yeah, it's bittersweet.
That's right, they work, but I think the question's really saying, are there issues in the future that I wouldn't have had with the older method? No, it's even better. All right, let's go to Vicki now, who's been nice enough to call. Vicki, welcome in. You have a question for Dr. Ackerman.
Yes. Once you come in, if you have teeth that need to be pulled, do you get them right away, or do you have to wait so long without your teeth?
Yeah, so I always say you'll never not be without teeth. So, you know, if you do have to have teeth pulled, we do want those extraction sites to heal up for about 4 months. But we will have a denture or a temporary or something made for you before you have the teeth taken out. So you will never go without teeth. Yeah, but we do require a little bit of healing time because we want the bone to be nice and good for when we do place the implants. But you'll never not be without teeth.
All right. So before I go back to the phone, someone asked the question. They must have just tuned in because you covered this. But just to confirm, you can do a partial too. If it's one or two, if someone's wearing a partial or a flipper or whatever, you can take care of them.
Yes, we can get rid of the partial and the flipper, and you know, place the implants in those areas and do the crowns, teeth, and get rid of the partial.
All right, just wanted to be clear there. All right, Reverend Johnson joins us now. Reverend, thank you for joining the show. You have a question?
Yes, my question is, do you have to do locals, or can they put you to sleep, or will it cost any more?
So I do not do sedation. I don't even have my sedation license because with the mini implants it is, you know, a lot less invasive.
It's just Novocaine,
and
right?
I understand, if maybe you're a little apprehensive about it, and I've had, you know, patients, but, you know, once you usually once I put one implant in, I tell the patient, and they're like, really, that's it? And I'm like, yeah, I just put an implant in. So I understand your apprehension, but we really don't require sedation. And like you said, it does add cost if you do sedation. So we just, do a little local anesthetic, numbing. You are awake, but once I get you numb, it's really, and I'm not saying that just because that's what my patients tell me. So
I think people are apprehensive because of maybe past experiences at the dentist, and you're going, okay, is this going to be painful? No, like you said, it's just a little Novocaine, a little prick of a needle, and then you're numb.
Let me get you numb, and we're good to go.
I like hearing that. And again, I want to repeat, consultations are free, so if you're saying, I think I'm a candidate, I'd like to do this, this sounds fantastic, I love the technology, Freedom Mini Dental Implants, consultations absolutely free, right?
Yes, consultations are free. Like I said, we usually do a 3D x-ray, because that just gives me all the information I need about your bone and making sure you're a good candidate for the mini dental implants. So yeah, we're out on Dixie, across from Valley High School. Promise we're worth the drive out there. It's kind of hard to find, but definitely worth the drive and coming in for the free consultation.
Dr. Ackerman, if you can guarantee me a smile like yours, I'll pull on my teeth. I will pull them right here. There's the information for you. That's a perfect smile. We'll be right back on Wave 3 Listens Live.
Hope your new year's off to a great start. I'm Tim Jones, back for Toyota of Louisville. We've got customer cash back on a brand new Corolla, for example, $1,250 cash back, and we want your trade. Toyota of Louisville, a Swope dealership where nobody walks away.
With so many personal injury lawyers advertising, how do you even choose? In this town alone, there are lawyers that we let go, lawyers we fired, and you would never know, and they would never tell you. Here's my advice to you. Do your research on which lawyer you hire. Ask how many verdicts they've had. Do they do personal injury only, or are they a jack of all trades? And if you find a better law firm than ours, hire them. There's only one Morgan & Morgan, forthepeople.com.
Toyota of Louisville, home of the 7-day guaranteed appraisal. I'm Tim Jones, back in January. Great selection, 0 down delivers this weekend. We want your trade-in. Come see us on Dixie Hwy or log on to toyotaoflouisville.com, a Swope dealership where nobody walks away.
The kids will love it. You will love it as well. That's right. The Harlem Globetrotters are coming back to the Yum Center. If you'd like to win tickets, then you can do so now by being the third caller at 888-800-9283. If you'd like to go to the show, they're coming Sunday to the Yum, 2 shows at 2 o'clock and 7 p.m. Go to kfcyumcenter.com, and the tickets start at $30. Dr. Ackerman, again, thank you for coming on the show. And again, for everyone, the news is good.
Yeah, and I invite everyone, like I said, call for the free consultation. Like that one caller was a little apprehensive. If you're scared, I promise we've come a long way in dentistry. Come to the consultation and let me kind of explain it to you and ease your fears.
Yep. Be confident in your smile. You deserve that. Eat the foods that you love. And once again, throw away those dentures. I'd like to thank Dr. Regan Ackerman. I'd like to thank you for watching. And you're invited to tune in tomorrow for the Thursday edition of Wave 3 Listens Live. Have a good one.